Well, hello and welcome to a clinical case vignettes with Dr. Childress. And what I'm doing with this series is presenting various clinical case vignettes drawn from the family courts, um, basically drawn from the family courts. These are more structural. I'll begin with some of the more basic patterns, and then later on different variants of the pathology that's in the family courts. And so I'll be doing a series of seminars talking about different family patterns that arise in the family courts. And I'm going to be starting with the Smith family. And this is sort of a basic pattern that covers a lot of the general features. It's going to be a narcissistic dad pattern. And then I'll do the other variants, the borderline mom and the various other variants, differences that we find in the family courts. So with the Smith family, we have the targeted parent is the mother, and the father is the allied parent. We have 3 children, ages 12, 9, and 7. The features of the family, again, as I said, father's an allied parent, mother's a targeted parent. Multiple children. The eldest is a daughter, and then we have 2 younger brothers. The pathology is in its early stages of development. So the divorce and separation was within the past 2 years. And this is a simple family pattern. There's no step family involvement, no extended family. The presenting problem is that following the divorce, the court ordered a shared 50-50 custody with the children, who were 10, 7, and 5 at the time. The daughter and mother had frequent verbal arguments, and these arguments recently escalated into a physical altercation in which the daughter was angry and struck the mother, requiring the mother to physically restrain the daughter. 6 months ago, the daughter began refusing custody time with the mother. The father says he can't force her to go on visitations with her mother. Now, in terms of the assessment, just before we even get into discussing the case material, first thing we'd want to do with this family is do a parenting practices rating scale for the mother. So we want to document the mother's approach to parenting by documenting at 4 levels. The level 1 of the parenting practices rating scale is obviously you diagnosed abusive parenting. That's physical abuse, sex abuse, neglect abuse, methamphetamine addicted mother, something like that. Okay, so it's obviously a child abuse diagnosis. Level 2 may not reach that level of a child protective services foster care placement or something, but the parenting is severely problematic, extremely hostile, degrading, something like that. So it may not reach quite the level of child abuse, but it's pretty close. Level 3 parent. Now, if for level 1 or 2 parenting, our focus is going to be on the mother's parenting. Okay, I don't care what family dynamics are going on. If I've got a clearly abusive parent or really close to being abusive, I'm going to focus on that, especially with the child conflict things. And I'll put other factors on hold for a second until I can get the mother's parenting into a more acceptable range. Now, then the 3rd level, though, is normal range parenting. The mother is a normal range parent. There may be some things she might be able to do better. We might take her off discipline strategies and move her to guidance-based strategies or something, or little tweaks on her parenting. But basically, she's a normal range parent. And level 4 would be that she's a normal range and healthy parenting, that there's no problem at all with her parenting. And so we would first want to document that as our opinions about that. And I'll talk about how we get that information in a second. And the other thing we would want to do is an applied behavioral analysis using behavior chain interviewing. And we would select the 3 most or 2 most serious incidents of mother-daughter conflict and conduct an applied behavioral analysis with those. So we look at the before, after, or before, during, and after thoughts, thinking, or thinking, feeling, and doing. So thinking, feeling, doing, before, during, and after, and we do a behavior chain interview. What did you do? What should you do? What should you do? What should to identify what the cues are that are triggering the escalation and the fighting. So this is out of behavioral psychology. The other thing I would recommend consideration is the Roberts apperception test for children. Now, I wouldn't add this at the diagnostic phase. It's not going to give information that's useful necessarily diagnostically. But when it entered treatment, I might consider a Roberts apperception test for children. Provides wonderful information. Now, for a court-involved clinical assessment for attachment pathology, a child rejecting a parent, that's a risk assessment for child abuse to a differential diagnosis for each parent. And so a court-involved risk assessment for child abuse needs to be completed within 6 to 8 weeks. And I want to emphasize that because right now we have these custody evaluations going on for months. That is absolutely unacceptable. Okay, when we have a possible child abuse consideration in the diagnosis, which we do when a child's rejecting a parent, we have to get a risk assessment on that within 6 to 8 weeks. I'd prefer 4 to 6 weeks. But if I've got 3 children here, 6 to 8 weeks. But we need to get that diagnosis for both the treatment for a child protection response, but also for the court's decision making when child abuse is a considered diagnosis. And it's always a considered diagnosis when a child's rejecting a parent. Now, in assessing parenting, it's extremely important to recognize the rights of parents. That in the absence of child abuse, parents have the right to parent according to their cultural values, their personal values, and their religious values. And so we need to be very careful as psychologists here on assessing parenting to not overstep our role and begin imposing our value systems on the parent. And in the absence of child abuse, each parent should have as much time and involvement with the child as possible. So I can't tell which relationship is better. That's a qualitative decision, and it's just impossible to decide. So in the absence of child abuse, parents are allowed to parent according to their values, and each parent should have as much time as possible. And in the absence of child abuse, to restrict either parent's time and involvement with the child would damage the child's attachment bond to that parent, thereby harming the child and harming that parent. So from a clinical psychology perspective, the only thing we're worried about is child abuse. And that's why we need to get that diagnosis back quickly, because that's the focus of what we're working on. The court needs to know in this mother-daughter relationship, is there child abuse going on with the mother, or is this just normal mother-daughter kind of stuff and we need to fix it through treatment, or is there some other issues involved? Now, in assessing parenting, I have a whole nother seminar on how to do that, how to identify the problems and what type of styles of parenting are going on. So I'm not going to cover the assessment of parenting in these clinical case vignettes. I'm going to remain more focused on just the pathology and discussing the nature of the pathology and the treatment that we would use based on the pathology in the family. So here's a genogram. That's what this is called, a genogram for the family. It's a picture of the structure of the family. Men are always, or males are always squares, females are always circles. And so we have a 12-year-old, 9-year-old, 7-year-old, Mary, Sam, and John, mother, father, married 14 years, separated, divorced the last 2 years. Now, if you're working in the family courts, let me pull this down, talk about that. If you're working in the family courts, you should always be doing a genogram. on your families. This is a disorganized attachment. If you don't know it's a disorganized attachment, you need to go learn and come back. This is a disorganized attachment. The child has no organized strategy to bond to the mother in this case. That daughter has no organized strategy to bond to the mother, and she's seeking to flee the mother. So that's a disorganized attachment. And the treatment, one of many treatment, what the treatment for disorder is to bring organization. Okay, that's going to be a fundamental thing, and this is going to be a very chaotic family, a very chaotic situation. So our treatment, our focus needs to be bringing, and the genogram is your first step in doing that. And then we will add like step families, step children, and take a look at that. But this will give us a good visual representation of the structure. And this is standard family systems. So while diagnostically, we need to be competent in delusional thought disorders and in attachment pathology, treatment-wise and just understanding and working with the family, we must be competent in family systems. And this is foundational to family systems. So draw up a genogram for your families. Do this all the time. On my first 5 minutes, I'm working up the genogram for the family. Now, this pattern, okay, so just I'm looking at this pattern here. Let me talk about a couple of features. We see a father-daughter relationship as the lead relationship. Now, that's going to be the pathological parent, narcissistic, borderline, dark personality parent, in this case, the father, is going to be targeting the eldest child typically as a regulatory object. Now, what happened here was that the divorce was a narcissistic injury to the dad. And so he wants to restore his narcissistic image by making the mom the rejected one. I'm not the rejected spouse, parent. You are. You're the rejected and inadequate one. And so there's all sorts of compensatory stuff he's doing. And he gets his daughter to say, oh, you're the wonderful dad, and mom's the evil mom, to enact that escalation of his or reestablishment of his narcissistic defense. I'm the wonderful one, and you're the problematic one. And so the pathological parent only needs one regulatory object to do that. The moment the daughter starts rejecting her mom, then all the narrative gets put in place. And so the two younger boys, Sam and John, are likely to escape early conflict. So they're going to fly under the radar for a little bit, and all the focus is going to be up on Mary. But over the course of time, the two boys are going to get drawn into it. And so, but when you're looking at a family, it's going to be the eldest child, and then you want to look at the gender factors involved. There's 4 types of relationship in the family that depend on gender. Gender of the parent and gender of the child. 2 are cross-gender relationships. Those are your high affection bonds. 2 are same-gender relationships. Those are your values and identity bonds. So here we have the lead child, who's going to be the regulatory object, is on the high affection father-daughter bond, and we have the mother on the same-gender identity bond. That's a significant problem I'll talk about in a second. And so that's just beginning, just right off the top, just looking at the genogram, I've got essentially the incest pattern. It's a special relationship between the father and the daughter that excludes the mother. That's really problematic for Mary, okay, to be in this situation where she's replaced her mother after the divorce and the father's affections. That's psychologically problematic. So we love high affection from the father-daughter. We want lots of love coming on that father-daughter bond. And we always want the balancing influence of the mother in there. It's when we lose the balancing influence of the mother-daughter relationship that high affection bond begins to get problematic, just structurally. I'm not saying there's sex abuse involved. It's a ripple of sex abuse is what it is, a special relationship between the father and daughter that excludes the mother. It's second generation, third generation of the sex abuse. It's just transgenerationally moving through the family. The other thing I know, just on this diagram, is we have in the sibling unit, we have an eldest daughter and 2 younger boys. there's potentially she's been in the kind of semi-mom role for a lot of time. You can imagine, she was 5 or something or 3, 4, as the 2 brothers are born, and so maybe the mom helped her or asked her to help out with the raising of the kids, and then she's got 2 little brothers, and she's kind of herding them around with the mother, and so there's a whole sibling unit there that's has its own culture and its own stuff. And it's going to be important to maintain that sibling unit and strengthen it, because that's going to be a source of resilience for all 3 children in the conflict situation. So that bond with her brothers is going to be real important to Mary, and she's going to feel a nurturing bond to them. And then the boys are going to, the leadership of Mary's, their older sister, and going back and forth between houses is going to be very valuable. So we're going to need to focus on that sibling unit and make sure we get a strong sibling unit out of that. And then we have the mother on the high affection, mother-son bonds. So that all of a sudden, just based on just what the family looks like, I'm getting a lot of information that potentially comes in. Now, the concerns, as I said, this would be the narcissistic dad pattern. Now, with this, we're concerned with the dark triad and dark tetrad. So let me say something about that for a second. While narcissistic and borderline are useful terms because they have a history and a lot of research with them, and we kind of know what their patterns are, it's more useful for treatment to think of them as unresolved trauma, and it's more useful in terms of diagnosis, to think of them as the dark personalities, dark triad and dark tetrad for the male, and vulnerable dark triad for the female, borderline version. Dark triad is narcissistic, psychopathic, Machiavellian manipulations, very dangerous human, that psychopathic component. The dark tetrad is when we add sadism to the dark triad. Extremely malevolent human, narcissistic, psychopathic, Machiavellian levels of manipulation, and sadistic. So with the narcissistic dad pattern, we immediately become concerned about the possible dark triad, dark tetrad, and that raises issues of spousal abuse using the child as the weapon. So right off the bat, I've got a spousal abuse diagnosis on the table. And what the psychological feature, another psychological feature of the narcissistic dad pattern, is this is the bad mommy pattern. So the unresolved trauma is with his own mother, and he's got split representations and stuff, but he's got this bad mommy in his attachment networks. And while they were married, she was the good mommy, but then, or supposed to be the good mommy who was all nurturing to him and being wonderful. But then when the divorce happens, she becomes the bad mommy. And then that gets transferred, projective identification gets transferred over to the child. And now it's Mary who's saying, "You're a bad mommy." But she's expressing the theme of the father, the internal working model, the schema of the father of the bad mommy. So that's what we have with this pattern. Now, also what we have with the narcissistic pattern is we have an emotionally empty father. That's the nature of narcissists. They sacrifice intimacy for safety, but they have no love inside. Their absence of empathy. So they're emotionally empty, typically an avoidant attachment. And let me say something about that, because in this family, we have the lead bond is the father-daughter bond. That's the high affection bond. And we have a father who's not capable of love. And so this daughter is like dying for the father's love and affection. And so then he can use that to manipulate her by giving her this wonderful narcissistic attention and stuff. When she pleases him, then she's just going to fall right into that. And then if he kind of gets sour or withdraws a little bit when she displeases him, she'll know not to do that. Okay. And so the daughter is very vulnerable to being manipulated, to being groomed and seduced into a special relationship with her father against the mother. I'm not saying it's sex abuse. I'm saying it's the ripple of sex abuse. It's the pattern of sex abuse, and it's the pattern we want to interrupt and stop because it's not healthy for the child. It's not healthy for Mary to be in a special relationship with a father who's a mother where dad's kind of seducing her and into this relationship. So knowing the patterns um, can guide your interventions. Another feature about this pattern is dad is going to want to present as the all wonderful dad because he's trying to restore his narcissistic sort of self image that was damaged by the divorce. So when you get him into your clinical interviews, that's going to be very distinctive presentation on his part. There's going to be two features of his presentation as you're interviewing him. One will be presenting the mother as the bad mommy, how inadequate she was, and how, oh, she was just, he will have a whole list of ways in which the mom in this family is inadequate. And then when you talk with him, he's going to be just the most wonderful parent in the world. And there's your splitting. That's your polarization. All good, all bad. Mom's going to be all bad. He's going to be all good. Okay. And as you're interviewing him, you want to explore for empathy. What's the mom's experience of, and what you will get as you will explore for empathy and the reasons for things, you will get him offering a justification that the mother deserves to be rejected by Mary because of the mother's inadequacy. That's your spousal abuse theme. Yeah, of course I hit her. She deserved it. My dinner was cold. The person deserves the cruelty because of some inadequacy of theirs. That's a narcissistic value. The actual value system is we're not nice to other people because of who they are. We're nice because of who we are. So again, that's going to be important when we get into treatment with Mary, is we're going to have to readjust her value system relative to her mother, because Mary's going to come in and say, it's okay for me to be mean and stuff to my mother because she deserves it, because she's a bad mother. And we're going to have to correct that, say, no, you're not nice to your mother because of who your mother is. You're nice because of who you are, Mary. And so we expect a level of just normal social skills kind of out of you, and politeness and respect, please, thank you, you're welcome, those sorts of things. And so that's another feature of this. He's got the all wonderful dad and the inadequate mom. And once you know what the pattern is, it'll just jump right out at you. Now, as I said, here we have we have an inverted hierarchy. Where the child will be judging the adequacy of the parent. So that's the other feature to look for. The inverted hierarchy is coming from the cross-generational coalition. The dad is going to support the child elevation in the hierarchy from the sibling unit up to the adult unit, and the mother will be dropped down into the child or unit or child level. And so the child will be judging the parent as if the parent was a child and the child was a parent. That's called an inverted hierarchy. And it's created by the support of the cross-generational coalition. If you don't know this, you need to learn this. This is family systems. This is Bowen. This is Mnuchin. This is Paley Madonis. If you're going to work with families, you need to know family systems. So we got an inverted hierarchy. We got the eldest child is female, and with a dad that's going to produce the psychological incest pattern. The special father-daughter relationship that excludes the mother, and he's going to use his manipulative attention to psychologically groom and seduce the child. Now, again, I'm not saying there's sex abuse in the family. I'm saying it's creepy, and we need to interrupt it. And then there's a high degree of concern for the spousal, emotional, psychological abuse of the mother. The research literature has called the dark triad and dark tetrad the core of evil. So if we've got this pattern, we need to be cognizant of how severe the father's pathology may be. Now, one of the things we're going to want to watch out for with this family, notice I haven't gotten into like what's going on, or it's just basics just off the structure of the family tells me all this information. We want to protect against a fractured family. And this involves abandoning Mary to the child abuse by her dad. And so as things go on, Mary's going to become very enmeshed and aligned with the dad, whereas the two boys will stay bonded to their mother. And if you got incompetent mental health people involved in courts that don't know what the pathology is, you haven't got an accurate diagnosis of what's going on, then sometimes it will make an error. And because they don't know what else to do, they will leave Mary with the mother, and the two boys are moving back and forth between the two parents. And that splits Mary off. And so ultimately, the question from the child as an adult will be, why did you rescue Sam and John, but you didn't rescue me? Why did you abandon me to my dad and not protect me as well? And Mary's going to have a good point. We never abandoned a child to child abuse. And this would be abandoning Mary to the child abuse. So this is an unacceptable solution. Okay, we and for a variety of reasons, it's unacceptable to just Sam and John and everything. The other problematic development that we need to prevent is the spread of the pathology from Mary into Sam and into John. And that's going to happen over time because, and let me explain why that happens. Initially, the father is just going to need a single regulatory object to enact the trauma reenactment narrative. Mary's being abused by the abusive mom, and I'm the protective parent. There's your trauma reenactment narrative. And that the narrative that I'm the all wonderful parent and mom is the inadequate, rejected spouse parent. And all he needs for that is Mary. Okay, he just needs to produce Mary's rejection of her mom, and all those narratives are in place. However, once that's stabilized, then the splitting pathology of the polarization will not allow the ambivalence of the younger boys maintaining a bond while dad and Mary reject the bond with mom. And so the splitting pathology is then going to require the two boys to also join the alliance with the dad and the mother, or dad and Mary against the mother. And so dad will start to use Mary to pull her two siblings in using that sibling bond. And oftentimes when this sort of pattern, especially on the borderline mom pattern, they'll put the oldest child in charge of protecting the younger siblings when they're with their mom. A clear communication that somehow the mom is dangerous to the children if they need the daughter to protect the children from her own mother. I mean, like, wow. And so that's what we need to protect against, is the spread of the pathology from Mary, and then it'll spread into Sam, and then ultimately it'll spread into all three children, and we'll wind up with cutoffs in the entire family over the course of time. So we want to get on this quickly, we want to get it on and early, and we want to fix it early. We always fix things. So the diagnosis. So first thing we want to do is get a parenting practices rating scale for the mother. We want to document where our assessment is of her parenting. So there's levels 1, 2, 3, or 4, from abusive range to normal range healthy. We want to rule out abusive range parenting by the mother, because we want to act with the certainty that the mother is not a risk to the child, and then we can restore the child's attachment bond. If we think the mother is somehow a danger to the child, if we think she's a level 1 or 2 parent, then our focus is on the mother, not anything else. Okay. But if she's level 3 or 4, then we feel comfortable to restore the bond and to say, no, your mom's not abusive, and your siblings don't need protection from her, and that's a delusional thought disorder, because we've done that assessment and parenting assessment and other seminars on that. The next thing we want to look at, though, is the persecutory delusion. For that's a mental status exam of thought and perception. If you're a mental health professional, don't know how to do a mental status exam of thought and perception for a possible delusional disorder, you should not be working in the family courts, because the differential diagnosis is a persecutory delusion. So I recommend you get training. I recommend all the mental health people, I probably should put this on the assessment, all the mental health people should know how to do the brief psychiatric rating scale, BPRS, item 11, unusual thought content. That's a delusion item. They got some other nice ones, anger and anxiety and depression and a lot of suspiciousness. But that item 11, unusual thought content, get a rating on it, because if you get a rating on it, my ratings, when I look at just something like this, is going to be a 5. Okay, moderately severe persecutory delusion. When I'm doing my diagnostic assessments using the mental status exam, so, and then getting that documented on the BPRS would be good for the courts. It would be good for second opinions. It would be good for, if somebody's going to challenge your diagnosis, well, take a look. This is matched up to the BPRS rating of a moderately severe delusion. So, so you need to know how to diagnose a persecutory delusion. Then for the factitious attachment pathology imposed on the child, you're going to want to look at a response to intervention. You want to look for the attachment pathology, and whether it's authentic or false, you want to look at the direction of the child's motivation. The attachment system is a motivational system. All motivational systems have a direction to them. Eating, pain, pleasure, sex, attachment, they all motivate towards a direction, because the other motivational direction was death by starvation and predation. Okay, so that's the origins of a primary motivational system. So when you're looking at authentic versus inauthentic or factitious attachment pathology, you want to look at the direction. So if there's a barrier to bonding, problematic parent, the child wants to bond to that parent, but there's problematic parenting preventing that, you'll get the protest behavior and the fighting, okay, as the child tries to bond and can't. Okay, now, and so the treatment for that, response to intervention, remove the barrier and the child will bond in. If the child's medium, just get rid of the barrier, boom, and then you got the proper motivational direction. For factitious attachment pathology, when you remove the barrier, the child still wants to flee, because the child was never seeking to bond to the parent. So you can do whatever you want with the parent, and the motivational direction is wrong. And so that's the factitious attachment pathology. So it's a response to intervention, and you'll identify what direction the motivation is going in. Then we want to, child psychological abuse is on the table, okay, as a diagnosis. If we got somebody producing a persecutory delusion and factitious disorder in the child for secondary gain, regulatory object, spousal abuse weapon, and to manipulate the court, then that's child psychological abuse. And we got a spousal and partner abuse psychological, in this case of the mother by the father using the child as a weapon. So when we return a diagnosis of child psychological abuse in this situation, we don't start with a treatment plan with dangerous pathology. There's 3 dangerous pathologies: suicide, homicide, and abuse, child abuse, spousal abuse, and elder abuse. And so that we're in the category of dangerous pathologies, in this case, an abuse pathology. 2, abuse, spousal and child abuse. Now, with the spousal abuse, if we fix the child abuse and restore a healthy bond to the mother, we'll also solve the spousal abuse. So we're going to stay focused on the child abuse and for our treatment plan, but we're going to acknowledge that we have a second abuse victim here that we may need to get some support into and stuff, and that's a traumatized brain in that person over there. And they're trying to navigate the legal system and everything. We need to get some support into the spousal abuse victim, psychological and emotional spousal abuse by a narcissistic dark triad, dark tetrad, spouse, ex-spouse. So with all dangerous pathologies, we do not start with a treatment plan. We start with a safety plan. So if you have a suicidal patient, the first, you don't do the therapy on what made them suicidal, you are getting them into hospital. Okay, you're hospitalizing or getting a safety plan in place to prevent the suicide. It's crisis oriented, very active. And so in all cases of child abuse, we always protect the child. So that's what we would do here. We would get about probably, generally I would say about a 90-day protective separation. About 3 months would be sufficient. Potentially less, but potentially more, but not, I wouldn't want really more. But we have a 12 weeks here. And notice something about this. Notice how we're keeping the sibling unit intact here. And so we have a dark triad, dark tetrad father. And so we need to acknowledge that we have a seriously malevolent dad with these 3 kids, and that we want to attend to the sibling focus. And so in this situation, by keeping the children together and bringing them over, we're doing a couple things. We're establishing that sibling unit again. So the Mary and Sam and John can all get mutual support from each other. The other thing we're doing is we're reestablishing a proper hierarchy in the family from the inverted hierarchy. So the mother is in charge of the family. She's in leadership. And what we'll tell Mary about the protective separation is, and this is why you need the child abuse diagnosis, because that's an accurate diagnosis. And I'm going to have to explain that to Mary. And I'm going to say, well, Mary, the professionals are concerned about your dad's parenting, that your dad's parenting is sufficiently problematic that we feel that we need to protect you and protect your siblings, that there's a child protection because he's not guiding and leading this family properly and in a proper direction. And I might describe to her about, there's an intact family, I don't know, 12 years old, but 13, 14, certainly. But there's an intact family, that was united by the married. And what divorce is just simply the parents are no longer living in the same house, but you're still a family. Okay, it's still your mom and dad. It's just your parents aren't living in the same house. You're now in a separated family structure post-divorce. Easy beat. But now sometimes the conflict up here at the parents can get so big that it rips the family apart. And then you have to choose sides. And so our question after the divorce here for the professionals, for the court, is which of your parents, your mom or your dad, is going to lead this family into a successful post-divorce family versus a cutoff family. And our opinion is your dad's going to lead this family into a cutoff family where you're not going to have a relationship with your mom and there's going to be all sorts of conflict. And then your brothers are going to get brawl and everybody's going to be in conflict for a long period of time. And that's under your father's leadership. And so we've decided to give your mother leadership of the family. That doesn't mean your father's gone. No, he's your dad. Holy cow, he's part of your family. But we're going to allow your mother to take leadership because she's most likely to lead this into this healthy family where all you 3 of you guys are bonded to your dad, all 3 of you guys bonded to your mom, everything's solved, and you guys can have a normal range like adolescence and high school and whatever. So we're switching that over. Now, mom is going to be taking leadership of this family. And as the oldest daughter here, you kind of have like responsibilities to Sam and John. Okay, they're your siblings and your little brothers. And so we're going to ask you to help your mother in that leadership of this family. And so we're going to ask that various things of you, that you kind of work with your mom, we resolve these conflicts with your mom, and that you help your mother lead this family into a successful family relationship. Now, what I'm doing, many things I'm doing with that, but I'm reestablishing there's a hierarchy. So the mother is at the top of the hierarchy, but Mary, as the eldest child, also is on a hierarchy on the siblings. So I'm activating that sibling hierarchy and her sense of responsibility for leadership with the siblings. And in that responsibility for leadership, I'm reestablishing that identity bond with the mothers, that she's assisting her mother, like probably she did when, the 2 little boys came in and she was helping her mother with the parenting of her brothers. And so I'm reestablishing that mother-daughter bond or relative to taking care and leadership of the family and stuff. And I'm giving her something to do to solve the problem. Okay, so rather than just a passive and everybody's fighting and what can she do, I'm giving her something. We want you to join with the mother. And then we're going to join in the treatment alliance, the therapist, the mother, and Mary, on helping to lead this into a normal range relationship with their dad. And we'll talk about that in a second. So that's the initial pieces, the protective separation on that. Then the next phase after that 30 or 90-day protective separation period is we would likely, in this situation, I would consider the contingent visitation schedule. And we got a dark dad, so we know we have a dark dad, but you replace the protective separation with the contingent visitation schedule. Now, if you don't know what that is, you go find videos on that, and you should go watch them. So what that does is basically we're going to be rating all three children. Mom is going to rate Mary and Sam and John on affection, cooperation, social involvement, 1 to 7, every day, and she's going to email those three numbers to the family therapist. And then in the family therapy at the week, they're going to talk about the ratings and what happened, apply behavioral analysis, behavior chain interviewing, and that provides a treatment verification for the ratings and stuff, and it takes the focus off of past events and you did this and you were that, and brings it to the current. We can't do anything about the past. I can do something about now. So what was the conflict this week on Tuesday about they got the rating of 1? So what happened? We walk it through and we develop breach and repair. We develop the ways to fix the problem, whatever the conflict is. Empathy back and forth, negotiation, cooperation, and proper hierarchies. We can figure it out. And so that's helping the family therapist guide the three children into a successful post-divorce family. In addition, though, we're going to use those ratings to make decisions about the transfer of custody and schedules and things based on the child's symptoms. So the way we're going to do that is a successful day is defined as 3 or higher on that 7-point rating. So I don't need to get 6s and 7s to be successful, just normal. 3 or higher is normal. So if they get 5 successful days out of a 7-day period, week on, week off, something, shared custody, that's a successful week. Okay, so they can even mess up 2 days in the week, and that's still a successful week. But if they only get 4 successful days out of 7, then that activates the contingent part, which is now they need to get 3 consecutive successful days with their mother, and then the custody schedule goes back to, but with no makeup days. So dad would just simply lose those days. And so there's a variety of things that's doing. It's a strategic family systems intervention that's designed to adjust power, and you can watch other seminars about that. But we want to put that in place. And what I would tell Mary about that as we move towards that, I would say, Mary, you're doing great. Okay, you're doing great. You're your mom, and you're helping with the brothers, and the fights are down. You look at your ratings are 4s and 3s and stuff, and you're doing great. So we're going to, because of that, we're going to reestablish the custody back and forth with your dad and get everything back to normal, because that's our goal. Our goal is normal. So we're going to reestablish with contact with your dad. Now, here's the thing. You're going to be able to tell us, communicate to us what's happening at your dad's house by what you do, how you respond. Okay, so if you stay at 3, 4, 5 or higher, with your mom, that's going to tell us that no matter what's happening at your dad's house, everything's okay, because you're handling it okay. Okay, you're 3, 4, 5 or higher with your mom, everything's fine. And so, okay. But if you drop to 1s and 2s and start getting into all these fights with your mom again, we're going to attribute that to your father. No, it's not him. Well, that's what we're going to say. We're going to say it's your dad's leadership of the family. And so then we're going to, have to take steps to do that. So all we need for you to do, Mary, is just to stay normal with your mom. And that'll make sure everything's, and then we get a normal family, a normal post-divorce family, and your brothers get a normal life, and everybody gets normal. So that's all we need. And we're giving her something substantial to a goal, something concrete, 3, 4, 5 or higher. It's coming into therapy. You're talking about what it's expected, what the expectations are and stuff. And so we're giving Mary some solid goals to achieve. And we're putting her in a nurturing role with her brothers, which is a proper, and assisting her mother, which is a proper hierarchy kind of situation on that to help. And, the other thing that this is doing is we're giving Mary an excuse to bond to her mother. Because you have to figure Mary's in a hostage situation. If she bonds to her mother, she's breaching loyalty to her dad. And the dad will then withdraw his affection, and then she'll, oh, Dad, don't, I want you to love me. And then it's just all sorts of bad stuff. So we have to give her an excuse, a cover story for why she's bonding with the mother. It's us. Okay, we're going to protectively separate you, and we're going to, continue visitation, and you're not going to spend time with your dad if you have problems with it. And so she'll say, Dad, I have to be nice to Mom, otherwise they're not going to let me see you. Works for me, as long as she's nice with her mom. As long as when we get over to her mom, that they have a normal range mother-daughter relationship. And I know that because I'm getting the ratings out of the mom. It says this is normal range. So I'm going, okay, Mary, you're good. And so providing that Mary with that protective cover is extremely important in psychological abuse cases. Now, that's also, though, why we need to be confident the mother is not abusive, because we're saying you're going to be with your mother if you have fights with her. So we have to be really confident that everything's okay with the mom and it's normal range, and it's just normal range conflict. We got into therapy, and it's not your mom's not abusing you in some way and that sort of thing. So that's sort of where we wind up with things, is on the outcome measure. All treatment should have outcome measures. We should be getting documentation that our treatment is effective in fixing things. And if it's not effective, we either need to redevelop our diagnosis or redevelop our treatment plan, because we need to fix things for this family, for Mary and this family. Once we got the protective separation, the 3 months, we move into the contingent visitation schedule. I'm expecting things to remain normal after that. So what is that? 6 months, 3 months, 6 months for stabilization, and everything's fixed. Okay, that would be a reasonable treatment plan for me. For attachment pathology, just normal attachment pathology, if I've got a cooperative parent, normal attachment pathology, cooperative parent, I would expect a resolution within 6 weeks. Okay, I'd expect significant progress within 2 weeks. And by 6 weeks, because all I have to do is remove the barrier and the child bonds back in. That's easy. If I got a cooperative parent, I just teach the parent what they're doing problematic. We stop it, and boop, the child goes right in. So treating authentic attachment pathology is relatively easy with a cooperative parent. The problem is we typically don't have cooperative parents. We have, substance abusing parents, or, physically abusive parents, or really significantly problematic parents who are abusing their children, creating the attachment pathology. So we always want to get an outcome measure on things. And this is my out. These are what I would recommend. Daily ratings, 7-point Likert scale on affection, which are the attachment networks, the love and bonding system, cooperation, which is emotional regulation networks, and social involvement, which gives us information on mood and arousal. And as long as those are 3 or higher, I'm a happy human. And relative to the treatment goals for all kids and all families, should be a standard of normal. We want to return to these children a normal childhood and normal range relationships with both parents. We don't need them wonderful, just normal. And we don't need them abnormal. The separated family happens all the time. It's not traumatic. It's uncomfortable. It's a difficult period of time. It happens, and then the child goes back and forth. Happens all the time. That's a healthy separated family. A cutoff family is not normal. So we never leave a family like this. This is a worst possible outcome. Worst possible thing we could do is leave a breached attachment bond unrepaired. That's the word. We always repair the bond. And a child belongs to two family lineages, to two family heritages, to two cultures, to two people. And each of those relationships is unique. You can't say one is better or the other. The mother-daughter is unique to the mother and daughter, and it's way different than the father-daughter. And you need healthy mother-daughter and healthy father-daughter. And the most important aspect of that healthy is that the child feels loved by that parent. We want the child to feel loved by her dad. And we want the child to feel loved by her mother. And coming into the assessment and treatment situation here, Mary was not feeling loved by her mother. They thought her mother was bad, and it's not happening. So we need to fix it. We need to accurately diagnose what the problem is, come up with an effective treatment plan to fix the problem. And with this problem, 6 months, and I would hopefully get everything resolved. I do not want to see a custody fight going on for years and years and years to the devastation of the children's lives. That's a failure of the mental health system to accurately diagnose and effectively treat the pathology. So with that, I'm going to wrap up my clinical case vignette on the Smith family, a rather relatively straightforward, simple family structure, 3 children, relatively early divorce. In the future case vignettes, I'll present different variants and then start to get into more complexities that can get layered on when we layer on stepchildren and step-parents and grandparents, and oh my gosh, dad had an affair, and it can get pretty layered on to this sort of thing. But we'll start with sort of the basics for understanding, and then move it in and understand how the complexities affect things. So with that, take care, everybody, and good luck out there.